Well, some Iowans with Medicaid coverage are worried about losing the care they receive because that program is ending and a new state program is beginning. The state says the new approach serves everyone. KCCI's Kayla James tells us why some people are concerned that that will not be the case.
The biggest concern is for individuals that need help navigating the system with disabilities.
And Marie Christian says that includes her.
I struggle with brain fog and just remembering to do certain things. They've been the person that's like, okay, here's a reminder that this form is coming due, and maybe can assist with that.
She tells us the Integrated Health Home program has been instrumental in her life. It's provided her and thousands of other Iowans with a care coordinator like Mackenzie McElhan, an IHH care coordinator with Stepping Stone Family Services.
That care coordinator goes out, gets to know them, does a very lengthy assessment to identify what their needs are.
Develops a treatment plan, creates goals, and identifies support and services needed for the person, leaving a lasting impression.
She's a friend. She's a lifeline.
On others like Jason Heckert, who says the program has changed his life.
It saved my life on multiple occasions, and not just through Sarah, but through the other workers that I've had over the years.
It's for that reason Heckert has spent time sending this email sharing his concerns about the upcoming change to state leaders. Iowa Health and Human Services did not have anyone who could speak on camera Thursday, but the department did share more about the change. In an email, a spokesperson wrote, there have been, quote, significant issues in the Integrated Health Home program over the last several years, and that it's caused a heavy administrative burden for providers to come into compliance with the required standards. Iowa HHS also shared more about the incoming Certified Community Behavioral Health Clinic program, saying the clinics must provide 9 core services, including 24-hour mobile crisis teams, targeted case management, and outpatient mental health and substance use services. It also noted the clinics will serve anyone, regardless of a diagnosis or insurance status. Despite this, there are people who worry.
We look at the whole person and not just their diagnosis.
Like McElhan and others at organizations like Stepping Stone Family Services.
You know, without that care and compassion, if that isn't continued through these transitions, you know, a lot of our members are really going to struggle.
I just feel like I'm going to get lost in the shuffle and that there's going to be miscommunications, and like I said before, continuity and consistency are so important for people like me.
Kayla James, KCCI 8 News, Iowa's news leader.
Iowa HHS says members of the IHH program will be transitioned to other case management services in phases beginning this month. The timeline has all members, both adults and children, to be transitioned from the IHH program to its end date by December 31st.